Indications. The indications for endodontic therapy are lesion. Every tooth, from central incisor to third molar, is a potential candidate for treatment. Far too often, the expedient measure of extracting a pulpless tooth is a short sighted attempt at solving a dental problem. Far too often, the expedient measure of extracting a pulpless tooth is a short sighted attempt at solving a dental problem. Endodontic therapy, on the other hand, extends to the dentist and the patient the opportunity to save the teeth. The concept of retaining every possible tooth and even the healthy roots of periodontically involved teeth and even the healthy roots of periodontally involved teeth is based on the even distribution of the forces of mastication. The final success of any extensive restorative procedure depends on the root surface area. The final success of any extensive restorative procedure depends on the root surface area attached through the periodontal ligaments to the alveolar bone, like the proverbial horseshoe nail. Root-filled teeth may often be the salvation of an otherwise hopeless case. Like the proverbial horseshoe nail, root-filled teeth may often be the salvation of an otherwise hopeless case. To carry this concept, one should further To carry this concept one step further, the importance of retaining even endodontically treated roots over which a full denture may be constructed, the so-called overdenture, is recognized. On some occasions, attachments may be added to these roots to provide additional retention for the denture above. On some occasions, attachments may be added to these roots to provide additional retention of the denture above. You can see in the figure 13. This is the figure 13 showing four locator overdenture attachments. Say just anchors. Ensure adequate retention or mandibular full denture without without losing the tooth, without extracting the tooth. It is endodontically treated over which an attachment is placed upon which a complete mandibular denture will be placed. At other times, the treated roots are At other times, the treated roots are merely left in place on the assumption that the alveolar process will be retained around the roots, and there will not be the usual resorption so commonly seen under fall or even partial dentures. You can see in the figure 14. This is the figure 14 showing the dramatic demonstration of alveolar bone C remaining around the retained canines but badly resorbed under maxillary full and mandibular partial dentures, but it is badly resorbed. under maxillary full and mandibular partial dentures, but badly resolved under maxillary full and mandibular partial dentures. But there is a preservation of alveolar bone to some extent if the tooth is present there. Modern dentistry incorporates endodontics as an integral part of restorative and prosthetic treatment. Modern dentistry incorporates endodontics as an integral part of restorative and prosthetic treatment. Any tooth with pulpal involvement, provided that it has adequate periodontal support, can be a candidate for root canal treatment. Even severely broken down teeth and potential and actual abutment teeth can be candidates for the tooth saving procedures of endodontics, provided all options with benefits and disadvantages are explained to the patients. Even severely broken down teeth and potential and actual abutment teeth can be candidates for the tooth saving procedures of endodontics, providing provided all options with the benefits and disadvantages are explained to the patients. One of the greatest services rendered by the profession is the retention of the first permanent molar. One of the greatest services rendered by the profession is the retention of the first permanent molar. You can see in the figure 15. You can see this figure 15 in the picture A. There is a pulp showing the pulpless first molar following failure of pulpotomy. Note the two periapical lesions and complete loss of intraradicular bone. You can also note two periapical radiolucencies and the loss of intraradicular bone. Right, draining sinus. The draining sinus tract opposite furcation is also present. Draining sinus tract opposite furcation is also present in this case clinically. In picture B, there is completion of root canal treatment without surgery, and in the picture C, 2 years recall radiograph. Total healing was complete in 6 months. New carious lesions now involve each interproximal surface. You can see by the arrows. In contrast, the long range consequences. The long range consequences of breaking the continuity of either arch are also well known. You can see in the figure 16. See figure 16. You can see extrusion, recession in the arrow indicated here. You can see the extrusion means outward project. The tooth comes out of its socket a little bit. Displacement of the socket out of the socket is called extrusion. Recession, you can also see the recession. There is a tipping, malocclusion, rotation, and gingival cemental caries are only a few of the long range consequences following early extraction of a permanent first molar. Extrusion, recession, extrusion, recession, tipping, malocclusion, rotation, and gingival cemental caries are only a few of the long range consequences following early extraction of permanent first molar. In addition to saving molars for children, saving posterior teeth for adults is also highly desirable. Retaining a root filled terminal molar, for example, means saving two teeth, the molar's opposite tooth as well. The molar's opposite tooth as well. You can see in the figure 17a. This is the figure 17a. The figure 17a terminal molar retained by endodontic treatment saves opposing molar as well. The by courtesy of Dr. L. Stephen Buchanan. In figure B, the fixed partial denture possible only by possible only because abutment teeth are saved by root canal treatment. Moreover, root canal treatment may save an abutment tooth of an existing fixed prosthesis. Moreover, root canal treatment may save an abutment tooth of an existing fixed prosthesis. The gain is doubled if the salvaged abutment is also the terminal posterior tooth in the arch and has a viable opponent. You can see in the figure 17b. In figure 17b, this is the what is the 17b. This is the 17b. Opposite tooth is also saved by root canal treatment. The gain is doubled if the salvaged abutment is also the terminal posterior tooth in the arch and has a viable opponent. Another candidate for endodontic therapy is the adolescent who arrives in the office with a grossly damaged dentition and is faced with multiple extractions and dentures. You can see in the figure 18 the caries decimated dentition in a 14-year-old girl. Personality problems had developed in this youngster related to her pain and embarrassing appearance. Rest in figure P. Restoration following endodontic therapy has restored cosmetic appearance and confidence so necessary for a adolescent. You can see figure there is loss of teeth. Many of these children are mortified by their appearance. It is gratifying to see the blossoming personality when an aesthetic improvement has been achieved. Many of these children are mortified by their appearance. It is gratifying to see the blossoming personality when an aesthetic improvement has been achieved. The end result in these cases would not be possible without a root canal therapy. You can see in the figure 19 See figure 19 obvious pulp. Figure 19 in picture A showing obvious pulp involvement of incisors, right? In figure 18 B, in figure B, root canal treatment of these incisors makes possible post restoration followed by cosmetic provisional crowns. A growing area in which endodontics play an important role is dental trauma. You can see in this chapter 36. Advances have been made in the understanding of dental trauma, and endodontics as a discipline has played an important role in treatment approaches. In developing treatment approaches, this is understandable considerable this is understandable considering the importance that the pulp plays in traumatic dental injuries.